there. Today I'm going to be making a quick video on C-section. So most midwifery clients are not planning on having a C-section. However, it can come up as a need, and because of that, it's a good idea to have some basic idea of what happens with a C-section. So should you need an emergency C-section, a true situation where the baby needs to be born immediately, this is a very rapid process, and there really is not a lot of time to take much of it in. With an emergency C-section, you're typically put under general anesthesia, meaning that you would not be awake for the procedure or for the birth of your baby, and that can be really challenging. If you have an emergency C-section, it's very important to have good support afterwards, which is something that your midwives can help facilitate for you, making sure that you have the opportunity to process your experience and really, it's a big deal for your birth plan to change, let alone for it to change in a really dramatic, emergent way. So your midwives will be there for you and make sure to connect you to good resources for just support in that entire recovery process in every way. That said, emergency C-sections are pretty rare, true emergency C-sections. Most C-sections, there's time to kind of process why you need the C-section and then have the whole procedure explained to you. So your midwife, if you've transferred to the hospital, your midwife technically is not acting as your midwife in the hospital, but she can continue supporting you in almost like a doula-like role. She can help explain, kind of what the doctors are saying about your situation. She can help you process and make decisions about what to do next. So she can take on, as I said, kind of a doula-like role. Some hospitals will allow midwives to stay with their clients for a C-section. I've been at a C-section with one of my clients. That said, every hospital has different policies and procedures on this front, and they won't always allow a midwife or a doula to stay with you for a C-section. They typically allow partners, so husband, spouse, to stay with you for the C-section. And it is, I think, if you're able to advocate for at least one support person staying with you, that's a really good idea, because sometimes the baby will need to be taken elsewhere after the C-section, and knowing that someone is staying with the baby is a really good thing. If it's at all possible to convince the hospital to allow your midwife or your doula to stay with you, that is optimal, because should the baby need to go elsewhere and your partner has to go with the baby, then someone can also stay with you. So that's ideal, but unfortunately, nothing's totally guaranteed once you go into the hospital setting. When the process of a C-section starts, you're initially given general anesthesia. So this will numb you from kind of like the rib cage down, completely take away sensation. After that, you'll be taken to the operating room where a nurse will prep you. That includes washing your abdomen, possibly shaving it, hooking you up to a catheter if you're not already, emptying your bladder, and also possibly starting some new IVs for additional hydration and medication. So before starting the surgery, the doctor will explain what's going to happen and also just make sure that you're entirely numb. When the doctor does make the incision, most likely it will be what's called a low transverse incision, and this is a horizontal incision across your abdomen directly above your pubic bone, and it's about 4 to 6 inches in length. And there's a few layers that have to be cut through in order to access your baby. Once all the layers have been incised, the doctor will break the amniotic sac and deliver your baby. Even though you'll be completely numb, it's very normal to feel kind of some tugging and some pulling as your baby is delivered. So typically with a C-section, there is a drape in front of your face that blocks your view of your abdomen, so you don't actually see the surgery. Occasionally, you can request a clear drape if you really want to actually see the whole process. But once your baby is born, typically the provider will lift the baby up in such a way that you can see them. Oftentimes after a C-section, a baby will need a little extra monitoring. So a nurse will typically take the baby, after the cord's been cut and clamped, or clamped and cut, to the warmer, and the baby will just be assessed for their respiratory effort, good transition, all of that. And then after that's done, typically then the baby would be passed to your partner, and they would be able to bring the baby around to you, and you can talk to them. Even potentially some skin-to-skin contact could be facilitated between you and your baby. Once that's all done, you and baby are stable. You'll be taken to a recovery. I'm sorry, let me back up. Obviously, your doctor will remove any other contents from your uterus, the placenta, the amniotic sac, manage any bleeding, just get all of that completely cleaned out, and then we'll suture the incision. So after that, you'll be taken to a recovery room. Usually at that point, a nurse can help you initiate breastfeeding. You'll still be numb at that point, and you will continue to receive medication that will help with pain management. It's very important to stay on top of medication for pain management with a C-section. Typically, you're going to be staying 2 to 4 days in the hospital after a C-section. Although it does, full recovery from a C-section takes about 6 weeks. So really important things after a C-section is going to be making sure you stay on top of your pain medicine. I'm working from some notes right now. Usually within about 24 hours, the doctors will allow you to get up and try to walk around. It's a good idea to try to have a bowel movement and have some movement to prevent any clots. So that will be a very supported process in the hospital. You'll be monitored for signs of fever, any signs of infection, any pain or redness at the incision site. And after that, once you're back home, your midwives can continue your postpartum care, and you'll probably still be under care of the doctors for continued recovery of your C-section, but your midwives also can be involved in, talking you through important pieces of recovery. So there's some kind of basic information about C-sections. There are some really great resources when it comes to just understanding more about the process and understanding what recovery looks like, and I'm going to link to those in the notes after this video.